Hi, I'm talking today to UK Nutritional Therapist Cheryl Wilson. Hi Cheryl, thank you so much for letting me interview you today for Askimo TV's International Library of Interviews with Experts.
Hi, it's lovely to be here. Thank you very much for inviting me.
Pleasure. Cheryl, today we're going to be having a discussion about nutritional therapy, what it is, how it can benefit people. So let's start off with, what is nutritional therapy?
Okay, well, I see nutritional therapy a bit like being a health detective, because what nutritional therapists do is they use their knowledge of nutritional science not only to promote a state of optimal health, but also to get down to the root cause of common health complaints. And most nutritional therapists, they practice something which is called functional medicine. So what they do is they ask 3 questions. Why did this condition happen in the first place? What keeps this condition going? And what interventions can we use to address the function of that person's body? So that's really in contrast to more of a band-aid approach to a collection of symptoms, which are then often labeled as a chronic condition. So what functional medicine does is it shifts from a disease-centered focus to a more patient-centered focus, meaning that the whole person is addressed and not just an isolated set of symptoms.
What sort of people would come to a nutritional therapist, and would you be able to see adults and children?
Yeah, nutritional therapy is fantastic for both adults and children. And actually, I find in practice that children's bodies respond very, very well to nutritional therapy, and very quickly as well. And I just put that down to them not having been exposed to the causes of dysfunction for as long as an adult might have been. So therefore, there's less degeneration in the body. And also, because they're growing and repairing at an exceptional rate, I think they also recover much more quickly as well.
And why is nutrition so important in our lives?
Okay, well, I think it is integral in our lives, because a person not practicing good nutrition is a bit like having a car that runs on diesel but filling it with petrol instead. So, of course, the inevitable outcome is going to be that petrol is going to damage the engine and the car's eventually going to break down in function. And the other way of looking at it is that our grandparents didn't even know what organic food was, okay? And that is not because organic food didn't exist. It was because actually, at that time, all food was organic, so there was no differentiation needed. And things such as intensive food production have actually only been around for about 65 years. So really, in the grand scheme of evolution, that's not a lot of time for our body to evolve, to all these new things that we're starting to come into contact with. So I really don't believe that our bodies have fully learnt to adapt to more intensely refined foods and chemically altered fats and high-powered sweeteners and additives, that just did not exist on the food chain 65 years ago. So, we've got a lot more to contend with these days, and taking a nutritional view of things and, working with a nutritional therapist, for example, can really help you to get your head around some of these big changes that have happened over the last 65 years.
And if I wanted to see a nutritional therapist, would I need a referral from my doctor?
Not necessarily, but it is one possible route. So, nutritional therapists, they usually work in private practice. So individuals might seek them out on their own, or they might be recommended by family or friends because that person's had a beneficial experience, or they might be recommended by another type of practitioner as well. So it could be a doctor, but it might also be an acupuncturist or an osteopath or a chiropractor, or even maybe something like a counselor.
And what sort of qualifications would a nutritional therapist have to have?
Okay, well, in the UK, I recommend seeing a practitioner that's trained to a level that meets national occupational standards. So you'll know if that is the case because that practitioner would actually be registered with what a body called the CNHC, and that stands for the Complementary and Natural Health Care Council. So as well as being a member of that body, and you'll know that because you'll see that badge on their website, or you can go onto their register and look that person up. On top of that, I would just make sure that they are actually insured to practice. And a good organisation for them to be a member of also is the British Association of Nutritional Therapy, otherwise known as BANT, B-A-N-T. So that way you can be confident that the practitioner is adhering to their strict code of professional practice.
And Cheryl, how is a nutritional therapist different from a dietitian?
Okay, well, dietitians work typically within the NHS setting, and nutritional therapists work mostly in private practice. And what dietitians do is they use the science of nutrition to devise eating plans to treat specific medical conditions in individuals. And what they also do is they work to facilitate positive change in food choices among groups and communities. Now, what a nutritional therapist does is slightly different. They consider each individual to be unique, and regardless of any diagnosed medical conditions, they always recommend a personalized nutrition and lifestyle plan rather than more of a one-size-fits-all approach.
And what would happen in a consultation, and how many consultations would I need with a nutritional therapist?
Okay, well, in a consultation, a practitioner asks the person about their current health concerns, their symptoms, their diagnosis and treatments, their medical history, family history, lifestyle, physical activity, so many things, that use of medication and supplements, and then last but not least, of course, the diet. And at that point, what a practitioner will do is they'll either get stuck into making recommendations based on their findings, or perhaps they might suggest some further biochemical tests to determine what disturbances there might be within the functions of the body. And so whenever you're at the advice giving stage, that advice will include setting goals around eating habits, changes to lifestyle, including exercise and relaxation, and the practitioner may recommend some therapeutic supplements for the person to take also. And I would say that if a person was coming to see a practitioner for a clinical issue, the average number of visits might be about 3 to 4 visits. If the person was more keen to transform their eating habits alone, perhaps with a goal such as weight loss, it's more likely that they might take on a program of about a 3-month period. And then that means they might visit the practitioner once every 2 weeks for coaching and support around the changes that they're making.
And just to end off, Cheryl, what do you think are the benefits of working with a nutritional therapist?
Well, the reported benefits from patients would include improved energy and vitality, elevated mood, more efficient digestion, increased immunity, more stable hormones, the ability to resolve issues around food intolerance and allergy, weight management, and what else? Relief from pain, and I guess just generally an overall sense of well-being is often reported.
Thank you. Thank you, Cheryl. Thank you so much for talking to me today.
You're very welcome. Thank you. Bye-bye.